This PowerPoint is over the head, neck, and torso muscles that you will learn for your Test 3. The first muscle we'll take a look at is the temporalis. So the temporalis has its origin at the temporal bone and has its insertion at the ramus of the mandible. And as you can see from the animation, the action of it is to elevate the mandible when speaking or chewing. This muscle is the frontalis. It has its origin as the epicranial aponeurosis. Now, the epicranial aponeurosis is not pictured here, but it is a sheet of connective tissue that actually connects the frontalis muscle with the occipitalis muscle. And there's a better diagram of that on the next slide. So we'll take more of a look at it at that point. So the origin is the epicranial aponeurosis. The insertion is actually the skin of the eyebrows. And with its origin at the aponeurosis above the frontalis muscle and the insertion at the skin of the eyebrows, then basically the action here is going to be to elevate the eyebrows. So anytime that you raise your eyebrows at somebody, you're contracting both your frontalis muscle and this muscle, the occipitalis muscle. So with the occipitalis muscle, its origin is actually the occipital bone. And its insertion is the epicranial aponeurosis, which here is pictured a lot better than in the previous diagram. So what the occipitalis does is it actually works with the frontalis muscle to elevate the eyebrows. And so right now, if you'll place your hands on the back of your head where the occipitalis is, raise and lower your eyebrows to the greatest extent that you can, and you'll feel that occipitalis muscle working. This muscle is the masseter. As you can see, it's another one of the muscles that's involved with chewing. So its origin is the zygomatic arch. Its insertion is actually on the angle and the ramus of the mandible. And again, the action here is to elevate the mandible in case of speech or chewing. This muscle is the zygomaticus major. This muscle has its origin on the zygomatic bone, and its insertion is in the corner of the mouth. Its action is to elevate the corner of the mouth. So when you smile, this is actually one of the muscles that you're using. This muscle is the zygomaticus minor. Its origin is also on the zygomatic bone. It has a slightly different insertion, the upper angle of the mouth. And its action here is to elevate the upper angle of the mouth. So it assists the zygomaticus major in terms of smiling or in lifting the upper lip. This muscle is the orbicularis oculi. This is one of those muscles that is named after its shape as it orbits the eye. So the origin of this muscle is actually the orbital margin. So some of the fascia and the bones surrounding the eye socket. The insertion is actually the skin around the eye. And so what this muscle is going to do is it's going to allow you to squint, but will also close the eyelid as well. This muscle is the orbicularis oris. So its origin is in the maxilla at the mandible. Its insertion is the skin of the lips. And so the action here is it purses the lips, and in the age of selfies, this is something that I actually call the duck face muscle. So when people do that silly expression, this is the muscle that they're using. The next thing that we're going to cover are the infrahyoid and the suprahyoid muscles. So if you'll recall that the hyoid bone was that standalone bone that reinforces and supports the larynx. And so the infrahyoid and suprahyoid muscles are either going to have their origin or their insertion with the hyoid. So the first muscle that we'll take a look at is the thyrohyoid. Now its origin is the thyroid cartilage of the larynx. If you look at the pink structure in the figure here, that's where the origin actually is. One of the cartilages that, in fact, the largest cartilage that makes up the larynx. The insertion is the hyoid bone. And so you can see where it anchors. You can see where the insertion is. And so the action here is going to be to depress the hyoid. So the reason why we're taking a look at the supra and infrahyoid muscles is because The suprahyoid muscles will elevate the larynx when you swallow. So if you'll put your fingers on your larynx and then swallow, you'll feel the larynx actually elevate and then depress. And so the thyrohyoid is one of the muscles that depresses the hyoid either during swallowing, in the latter portion of swallowing, or sometimes during talking. This is the sternohyoid. Its origin is in the sternum and the clavicle. The insertion is on the hyoid bone. And again, as you can tell from the origin and the insertion, the action here is going to be to depress the hyoid. So this is another infrahyoid muscle. This is the sternocleidomastoid, which is neither an infra nor a suprahyoid bone, but I stuck it in here because it's in the same general region. So this is actually a major muscle of the neck. Its origin is in the sternum and the clavicle. Its insertion is in the mastoid process of the temporal bone. And so when this muscle contracts, its action is going to be either to flex or to rotate the head. So if one of the sternocleidomastoids is contracting, then you'll rotate your head laterally. So for instance, if the left sternocleidomastoid is contracting, it will rotate the head to the left. If the two sternocleidomastoids contract together, then they'll actually flex the entire head. So basically, if you shake your head no, you're alternating between your left and right sternocleidomastoids. If you nod yes, then you're actually flexing the head. You're using them both at the same time. This muscle is the omohyoid, and this is kind of an unusual looking little muscle because of how long it is. So the omohyoid actually has its origin in the scapula, and its insertion runs all the way up to the hyoid bone. Its action is going to be to depress the hyoid. So here's another one of the infrahyoid muscles. This is the digastric muscle. This is the only one of the suprahyoid muscles that we'll be covering. So the digastric muscle is sort of this oddly shaped muscle. It actually has what's called an anterior belly and a posterior belly. The anterior belly actually runs from the mandible to the hyoid bone and narrows to a strip of connective tissue that goes under a ring of connective tissue that is around the hyoid bone. So there's this sort of loop that the digastric runs underneath. And so the digastric actually has multiple origins at the mastoid process and at the mandible. And so when these two origins contract, the insertion being at the hyoid bone, this means that the action is going to be to elevate the hyoid. The name digastric muscle is actually sort of a pun on terms. There are two bellies here, and so digastric literally meaning two bellies. Not a very good pun, but then how many anatomical puns actually are. The next thing that we're going to cover is the torso muscles. So the first muscle we'll take a look at is the pectoralis major, and this is a really massive muscle that has a number of different motions. And so what we're going to do is we're just going to assign it one major action. So the origin of the pectoralis major is the clavicle, the sternum, and the true ribs. The insertion point is actually going to be on the humerus, and the action is basically going to be to adduct the arm. Now, as you can see in the animation here, it does more than just adduct the arm. So it can actually extend the arm, it can rotate the arm medially, but the main action that I wanted to focus on here with the pectoralis major is that it adducts the arm. This is the pectoralis minor, so it is actually deep to the pectoralis major, so this is not something you would ever see in terms of surface anatomy. So the origin of the pectoralis minor is in ribs 3 through 5, and the insertion is in the coracoid process of the scapula. So this first action that you're seeing here, and let's wait for the animation to get back around. This first action is to depress the shoulder. So it'll depress the shoulder and rotate it forward a little bit. Now, if you reverse the origin and the insertion, then it can give the intercostals and the diaphragm and assist in forced breathing, as you can see there. Speaking of the intercostals, These are the external intercostals. And so their origin is actually the inferior border of the rib above the muscle. The insertion is the superior border of the rib below the muscle. And so basically, these muscles are going to pull the rib cage upward and outward. So their action is basically going to be to elevate the ribs for normal inhalation. So the external intercostals provide about 25% of the muscle contraction needed for a normal quiet inhalation. These are the internal intercostals. I realize that this diagram looks very much like the one you just saw with the external intercostals, but there are some differences here. So the first difference is the origin. So with the internal intercostals, which are deep to the externals, the origin is actually the superior border of the rib below. So if you'll recall, the external intercostals, their origin was the inferior border of the rib above. So your non-moving point is the rib below, and the insertion point is the inferior rib border of the rib above. Now this means instead of elevating the ribs, this means that the action of the internal intercostals is going to be to depress the ribs, and this will happen during forced expiration. Normally during breathing, expiration, also known as exhalation, is just a process of relaxing the muscles that have been used for inspiration. It is usually a passive process. But during sneezing or coughing or any occasion where you're pushing air out faster or harder than a normal inhalation, then you're going to use the internal intercostals as an accessory muscle for forced expiration. These are the serratus. This is the serratus anterior muscle. So this is a pretty large and complex muscle. And one of the things that I'm just going to tell you is that this animation doesn't really show well is that all of these sort of strips of muscle that run along these ribs, they join together into one muscle posteriorly. And so in this case, the origin is going to be ribs 1 through 10. And the insertion is actually the medial border of the scapula. And so as you can see in the animation, the action here is going to be basically shoulder protraction. So kind of moving the shoulder forward. This is the trapezius muscle, and it's a very large, very complex muscle. So we're going to take a look at some segments of it separately. But before we take a look at the separate segments, the trapezius muscle as a whole has its origins in the spinous processes of cervical and thoracic vertebrae. So this is all of the cervical and all of the thoracic vertebrae. And so this muscle is so large that it's basically divided into three sort of sections. Insertion first. The insertion point is in the clavicle, the scapula, and also, as you can see, the occipital bone. Now we're going to take a look at the three portions of this muscle separately in terms of the action. So as you can see with the animation that's been going on, the action of the superior portion of the trapezius muscle is to elevate the scapula, and as you can see what's happening right now, to rotate the head and neck laterally. Now if both trapezius muscles are working together, and this will come up in a second, then what it'll do is actually to hyperextend the neck backwards. Okay, so there's the scapula elevation. The medial portion of the trapezius has one major action, and that is to adduct the scapula. So as you can see, it's bringing the scapula back towards the midline of the body. So this is the medial portion of the trapezius. The inferior fibers of the trapezius basically act to depress the scapula after it has been elevated. So you'll see first the elevation. Okay, so there's the depression. And you can see that it will depress the scapula when it's either in the normal or in an elevated position. This is the latissimus dorsi. It's another very large torso muscle. So it's got multiple origins and one insertion in this case. So the origin of the latissimus dorsi is the spinous processes of T7 through T12, all of the lumbar vertebrae, and even down to the sacrum. The insertion is at one point, at the humerus. And as you can see, the actions, it has multiple actions. One action, as you see here, is to extend and also to hyperextend the arm. It will also, as you can see here, adduct the arm. That's what I think of as the major motion of it. And it can also rotate the arm medially. This is the diaphragm. Its attachment points are basically all the way around the rib cage, as you can see. So it's a dome-shaped muscle that will flatten out when it contracts, and its action is to expand the thoracic cavity for inhalation. So the diaphragm is responsible for about 75% of the contraction needed for normal inhalation. Now we're going to take a look at the abdominal muscles. There are 4 abdominal muscles, and we're going to look at these from deep to superficial. So this is the first and deepest of the abdominal muscles that we're going to look at, the transversus abdominis. Its origin is in the thoracolumbar fascia and ribs 7 through 12. Its insertion is the linea alba, which is sort of a midline running down the front of the abdomen. And so the transversus abdominis basically has the action of compressing the abdomen. So this is going to be when you tighten your muscles, and just when you tighten your abdominal muscles, or when you're compressing your abdomen as an assist for forced exhalation. This is the internal oblique. Its origin is the linea alba and ribs 7 through 12. Its insertion is actually the thoracolumbar fascia. And as you can see, it's got a variety of actions. So we'll wait for the diagram to reset and then cover these. So the very first thing that the internal oblique can do is to compress the abdomen. And so you see it compressing. That took it long enough, didn't it? It can assist in flexing the torso. It can also flex the torso laterally. And what I think of as its main action is it rotates the torso. This is the rectus abdominis, which you might also know as a six-pack. So the origin of the rectus abdominis is the pubic bone. The insertion is actually the xiphoid process and the cartilages of ribs 5 through 7. So as you can see here, the action of the rectus abdominis is to flex the trunk. So rectus is actually sort of a general all-purpose term in muscles for a muscle that will flex forward. So basically it'll flex just in one plane, and that will be to move something superiorly or inferiorly. So there are a number of different rectus muscles. The rectus abdominis is one, and there are also superior and inferior rectus muscles of the eyeball, which we'll see during the last week of lab. This is the external oblique, and so the external obliques have their origin in ribs 5 through 12. They have their insertion in the linea alba and in the pubic bone. And so very much like the internal oblique, it's got multiple actions, as you've seen, to compress the abdomen, assist in flexing the torso laterally, and also rotating the torso. So there's the assist in flexing the torso. Here's flexing the torso laterally. And here's rotating the torso. So basically the external and internal obliques, they do pretty much the same action, They'll both assist in flexing the torso. They'll both flex the torso laterally. But in terms of rotation, the external and internal obliques will oppose one another. So as you're rotating your torso, basically what you're doing is you are flexing, either you're flexing the external oblique or you're flexing the internal oblique.